This video is about eating disorders. Eating disorders are a range of psychological conditions that cause unhealthy eating habits to develop. They might start with an obsession with food, body weight, or body shape. In severe cases, eating disorders can cause serious health consequences and may even result in death if they are not treated correctly. People with eating disorders can have a variety of symptoms. However, most include the severe restriction of food, food binging, or purging behaviors like vomiting or over-exercising. Although eating disorders can affect people in different ways, especially genders in different ways and at different lifestyles, they're most often seen in adolescents or teenagers and also young women. 13% of youth usually experience eating disorders by the age of 20. So knowing that they're so prevalent, what causes eating disorders? Experts believe that eating disorders may be caused by a variety of factors. One of these is definitely genetics, and then also just different lifestyle situations or things that environmental factors can cause eating disorders as well. There are several different types of eating disorders. The first one is anorexia nervosa, which is probably the most well-known eating disorder. People with anorexia nervosa usually view themselves as overweight, even if they're dangerously underweight. They usually try to restrict food or just avoiding all kinds of food at the same time. The next one is bulimia nervosa. So like anorexia, bulimia tends to develop during adolescence and then early adulthood and then appears to be less common among men than it is in women. People with bulimia frequently eat unusually large amounts of food at specific time periods. There's also binge eating disorders. Binge eating disorders typically involves, it's very similar to that of bulimia, but they eat large amount of food in a short period of time, and they lack the control to control their binges. Common symptoms of binge eating disorders are eating large amounts of food rapidly in secret or uncomfortably until uncomfortably full, feeling the lack of control during episodes of binge eating, feelings of distress such as shame, guilt, or disgust while doing the binge eating, and then also the use of purging behaviors such as calorie restriction, vomiting, excessive exercise, or a laxative or diuretic use to compensate for the binging. There's also another eating disorder that I've not heard of yet. It's called pica. Pica is another eating disorder that involves eating things that are not considered food. Usually they crave things such as ice, dirt, soil, chalk, soap, paper, hair, anything that's just not really normal to food. That's another type of eating disorder that I thought was interesting because I'd never heard about it. So those are the eating disorders.